goes. Okay, see. How do I make mine big? How do I make myself big and everybody else small? Talking about the Zoom conference. Speaker. Oh, there you go. Except for why? How did you become the speaker?
Are we gonna quiz after both lectures?
Yes. Can you guys hear me? Can't hear. Okay, never mind. Unmute. Okay, Tara can hear me. Why the heck? Shannon, for some reason you're showing up as like the main person. Yeah, but she's like showing up as like when I try to make myself like the speaker, it's putting her as like the speaker. Now it's putting Jenny. How do I get myself to be there? That doesn't make any sense. All right. Sorry, I'm like Zoom stupid, guys. Last class was like the first time I've ever used Zoom.
Do you like having anything to do with it?
That'd be stupid if it did.
How do you turn my phone?
These two got like actual faces. Everything's plugged in. Well, my computer's plugged in. Yeah. Oh, no, it's not. Now it's not getting power.
Does the TV turn on?
No, nothing will turn on.
I feel like it's a switch somewhere.
That's the X-ray breaker, though. This is so annoying. There we go. Now I'm sorry guys, we're just trying to figure out some technical difficulties in the classroom. For some reason, we're not really getting power to the front. No, he says he's gonna be late. Yeah, it'd be great if I had his phone number.
Okay, we got kind of happen.
I know, that's what I don't understand.
That metal thing on the wall over there, the red button. I see lights on it, so I don't know. Like there's no like computer tower for this thing, so I don't really understand what's happening. Yeah, like the wall is static. Shit, I gotta plug in somewhere too. Let me see if this other wall outlet's getting power. I mean, you can turn it off and turn it back on, I guess. Yeah, this wall outlet's not getting power either. Yeah, this outlet's not getting power either. Yeah, I would call. Work here. Where there's actually a problem. Because my computer's gonna die in like 2 hours. So, all right, guys, we're gonna have to do this a different way from home. Everybody's gonna have to follow on their own PowerPoint. Something is happening with the electrical outlets in the room, so I can't make us live. So just so you guys know, pull up your PowerPoint and you're gonna have to follow along. It's gonna be a little bit more difficult for me. Well, I mean, at this point, they're gonna have to just listen to me talk instead of following along with anything video-wise anyway. So, because I don't have anything for them to see. So, all right. Do you guys all have access to the PowerPoint? Okay, good, awesome. You guys are prepared. Let me make sure everybody is here. I only have 17. Oh no, everybody's here. Okay, cool. So, 5, 10, 15. Okay. All right, Tara, just try to follow along for now. I'm just going to go ahead and start lecturing. Like I said, there's an electrical problem in the room, so I can't pull anything up. So video kind of is pointless at this point. Just listen to me talk, essentially, and just follow along on your PowerPoint. Okay. All right, guys, so we're going to start with Chapter 3, Abdomen Positioning. So the common views on these are going to be an AP supine abdomen, so the patient's flat on their back. It's going to be referred to as a KUB. So the reason it's called a KUB is you see the kidneys, the ureters, and the bladder. It's important to have all 3 of those in the picture, otherwise it's not a KUB. You also have your AP decubitus abdomen, where the patient is on their side, lateral, recumbent on either side. You have your upright abdomen. It's also a 1 view. You have your obstruction series. This includes a PHS x-ray, an upright abdomen, and a supine abdomen. In a 2-view abdomen series, AP upright abdomen, AP supine abdomen. So they're all ordered regardless of their age. It really just depends on what the doctor is looking for and what they feel like they're going to diagnose the patient with. So the reason we do differences between flat and upright is because air fluid levels. If we're looking for an obstruction, if we're looking for a foreign body, that kind of stuff. All right, so the muscles in the abdomen that are important for you guys to know are going to be your diaphragm, which is your umbrella-shaped muscle separating the chest and the abdomen. You have your psoas muscles. They're these long triangular lateral muscles in the back of your back. They line the back of your abdomen. You'll be able to visualize those really well if the patient is kind of like an average size to asthenic, like thinner person, and your technique is really well. They'll disappear on somebody that's obese. And then both will be visualized, obviously, using correct exposure factors on small to mid-sized adults. All right, so the muscles of the abdomen, there's some pictures on here. I would know these pictures, definitely be able to identify diaphragm and your psoas muscles. Yes. Are you having a patient? Everybody should be able to open it. It's under modules. I can't see the chat and the PowerPoint at the same time. Sorry. That's okay. Were you able to download it and look at it? Are you under Google Chrome though? Definitely uploaded it differently.
So none of our wall outlets are getting power. And then my x-ray room, like the breaker won't trip back on. It's like stuck in the halfway. Like if I flip it off and try to flip it back on, it won't go up to on. The breaker in the x-ray room, we have to turn it on and off all the time. That's what Mr. Graham has us turn it off all the time when we're done, yeah. Well, he's not here right now. He's running late today. Yeah, the wall outlets, like they're not getting any power. Okay. Okay. I didn't see you push the button. Are you able to open it? I was able to print it out. It's there. I just printed it out. You have to download it. Everybody's saying you have to download it. Okay, I don't know. Everybody else is able to access it, Ethan. I can email it to you. Here, I can email it to you real quick. Just that. Well, are you able to open the other one? Because we have to go into the other one after. Yeah. Fancy Apple computer, man. It's probably true. It's like an iPhone. Mm-hmm. Sorry, guys. Like technical difficulties real quick. We're pausing for a moment. Oh, sounds like something just got power. Oh, there you go. It sounds like whatever you guys just did turned these computers back on. Mm-hmm. That one tripped, yeah. There you go. I don't know. No, probably something like with the storms and stuff that we've been having. Sorry, guys, we're going to pause for a moment. I'm going to see if I can go live with video again. I just sent it to you, Ethan. I just emailed it to you. It's getting power. Yay! It's getting power. Okay, cool. Thank you. Why speaker view? Bro, I don't know. It's that MacBook. Everybody else been able to open it up. Guess what? I'm about to go on the screen, so.
Somebody else has it, it's unzipped, and you save it as a non-zip file, and then so the zip file is like when you got a big file, it compresses it down, it zips it, and then you unzip it. And sweet. You gonna airdrop it? Sweet.
That's coming on. As soon as this opens.
No, it's still a good. Don't worry about it. I'll figure it out someday.
Alright. Yay. Thank you for following those two. I'm pretty sure Mr. Green would know. No one heard me say that. All right, guys, we're live again, so you guys can listen to me, and then I'm going to point everything at the wall. We got power again in the room, so I'll pull the chat up. Okay. So we're just gonna start from the beginning since I didn't get very far to begin with. So everything's gonna look backwards to you guys on at home. Did anybody notice that?
No, it's not.
Oh, it's not? Okay, cool. It's all on my screen. Okay, cool. So chapter 3, abdomen positioning. We went over, so KUB, so it's going to be kidneys, ureter, bladder. The patient's going to be on their back. So supine means back. This will be pretty much your standard x-ray. And then you will always, 90% of the time, you're going to see this one. And then about 70 to 80% of the time, you'll see your 1 view upright. And then your chest, your obstruction series is very common, especially in kids. And then depending on who your doctor is, sometimes they just always want obstruction series for no reason. So they're always ordered regardless of age on anybody. They do them on babies, they do them all the way up to 100 years old. All right, so your diaphragm, your umbrella-shaped muscle separates your abdomen and your chest cavity. Your psoas muscles line the back of your abdomen. They're triangular and long. And then they'll be able to visualize both of them on a well-imaged radiograph. So this is where we left off at. So here's your psoas muscles right here, these long triangular muscles in the back. And then your diaphragm lines right up under here where the rib cage is at. All right, so to go into supine abdomen, this is your most common abdomen x-ray. So you're going to be patients on the table, flat on their back. You want to make sure that, I actually didn't put this on the PowerPoint, that all metal is moved out of the way. Metal will show up on your x-rays, so if they have jeans on with a zipper and a button, you make sure that you cover them up. Jeans come down past their bladder so that it doesn't show up in your x-ray.
What about a bra, like a outline?
So actually, I forgot to cover that in the chest x-ray. So if you're doing chest x-rays or abdomens, usually you're always gonna wanna make sure that the bra comes off, underwire and clips in the back. Those are made of metal, they will show up.
Can you put like a gown on it?
Oh yeah, yeah. You either have a gown in a hospital, wherever you work out, you're either gonna have a gown or some sort of sheets. If they're like laying flat, you can just cover them up with their blanket or whatever they're wearing. They can always leave their undergarments on. You never have to have them take their underwear off for any reason.
Jeans come off.
What?
Jeans come off.
Jeans just need to go down past your bladder. So anywhere like mid-thigh is totally fine because we're not x-raying all the way down there. The x-rays should stop right here, just past their pubic bone. So you're gonna center right here at the iliac crest. Your iliac crest is right here on your hips. So when people refer to their hips, this is your iliac crest, that hard bump right here in the front. Your SID in these cases is going to be 40 inches. We're closer to the patient so that we can actually magnify the organs because this is what we're concerned about. That's why we're looking at their abdomen. So 40 inches will be from the table. You'll also shoot your upright abdomens at 40 inches. The only time you'll go to 72 is if you're doing that obstruction series that requires a PHS x-ray. 72 inches for PHS, 40 for your upright abdomen and your flat abdomen. So you won't shield, obviously, because we want to make sure we get all the way to the bladder. If we shield, there goes, I mean, you won't be able to see your bladder, you won't be able to see your pubic bones, you won't be able to see a lot of things. You don't really need to. I mean, you can if the patient requests it, but it's not necessary. Plus, sometimes some diaphragms are really high, especially in kids. You're really not going to be shielding anything except for like right here, because their diaphragm's going to sit way, way, way up high. You can, we'll get to that when we get to the fluoro part. It shows where you can shield like the lower part if we're just looking at like upper gastrointestinal area. It's not necessary, like most people, just standard rule of thumb, you just don't shield for abdomen x-rays. It's not necessary. Unless, if, again, like the patient requests it. In this case, if a patient requests a thyroid shield, you can give them a thyroid shield. We're not looking at their thyroid, we're not concerned about their neck or anything. So, unless, again, you're doing the chest x-ray. Obviously, you can't do that. So your common name for it is going to be KUB, kidneys, ureter, bladder. A lot of the time when you see these ordered, it will say KUB. At a lot of places, it'll say abdomen 1 view, KUB. So just know KUB is the normal term for it. So you're going to get everything from diaphragm to bladder. So your diaphragm's right up underneath where your rib cage is at, or where it ends, all the way down to your pubic bones, where your bladder's going to sit. Your breathing instructions, I put on your expiration. Really all you're going to have the patient do is take a deep breath in and hold their breath, or they can just blow all their air out. It really doesn't matter as long as their organs internally have stopped moving.
So they can hold their breath. It's not going to make a difference on your film. They can blow all their air out as long as they're not breathing in, actively breathing. Either way works. No for the test, expiration, because that's what the book says. That's what the registry is going to say. Your technique at this point is going to be 70 to 80 kilovolts, 20 to 40 mass. This is average size patients. So like relatively somewhere like me, I would probably be about 20 to 30 mass because I'm a little bit smaller. If you're a little bit of a larger average male, you're going to do about 40. Anybody that's like huge, numbers go up because we're going to push more power and push more number of beam into the patient. And then obviously for marking, you can mark either side as long as it's not in the anatomy. So if you're taking an x-ray and the patient is flat, you can mark down here at the bottom because where we're looking is the pubic bones go in. So as long as it's on the side, it doesn't matter. Don't put it up here, it might end up in your diaphragm. Don't put it somewhere in the middle, it's gonna end up in the middle of the abdomen somewhere. They'll make you repeat it if your marker's in the way. Just right or left. Yeah, that's all you have to mark. So an abdomen 1-view KUB is going to be like the radiologist knows that it's performed flat. So if it's ordered upright, they know it's upright. If it's ordered KUB 1-view, it's always going to be a flat x-ray. So you only have to mark right or left side. You can throw supine on there if you really want to. It doesn't really matter.
I have a question.
Okay.
Is there a method or run to the kV and the milliamps, or is it specifically to each type of radiograph we have to memorize each one? So I'm trying to figure out if there's a way to figure it out based on the technique with like a rhythm or knowledge, or is it you have to specifically know each position?
You'll have to know specifically each position, but when you get to the extremities, there's it's going to be like lower to like, so thinner the body part, lower the technique. The thicker the body part, higher the technique. So that's kind of how it's drawn. The people that determine these numbers are, well, the last picture was good exposure factor. That's probably 80 at 20, depending on the size of that patient. Hey guys, I'm gonna hop onto the other meeting. I'm running out of time on this one, so I don't want anybody to get booted off. So if everybody wants to hop out of this meeting real quick and then hop into the other one, okay?